When discussing masturbation and prostate health in older men, many people assume that sexual interest fades with age, but actually that's not the case for most men. Today we'll explore the scientific evidence, real-life stories, and practical tips about how masturbation relates to prostate health in later life. If you find this channel helpful, please don't forget to like and subscribe. Studies from the US, UK, Canada, and other countries show that even after age 60, many men maintain sexual desire, though the way they express it may change. For example, a UK study found that nearly half of men aged 66 to 71 reported masturbating regularly. While partnered sex may become less frequent, masturbation often remains or even increases. This shows that sexual interest and desire persist with age, even if the way they're expressed evolves. Let's dive into how masturbation is linked to prostate health. The prostate is a small gland that produces part of the semen. As men age, the risk of prostate inflammation, enlargement, or even cancer increases. In fact, prostate cancer is one of the most commonly diagnosed cancers among men in the US, UK, and Canada. That's why maintaining prostate health is so crucial for quality of life in older men. Recent research has focused on how masturbation might affect prostate health. Large cohort studies at Harvard and Boston University have consistently found that men who ejaculate more frequently, including through masturbation, have a lower risk of developing prostate cancer. For instance, a study from Harvard School of Public Health found that men who ejaculated 21 or more times per month had a 31% lower risk of prostate cancer compared to those who ejaculated 4 to 7 times per month. Australian researchers also found that men who ejaculated 5 to 7 times per week before age 70 had a 36% lower risk of being diagnosed with prostate cancer compared to those who did so less than 2 to 3 times per week. Why does this happen? Researchers have a few theories. First, ejaculation may help flush out waste products and potentially harmful substances from the prostate. Regular ejaculation, including through masturbation, can reduce the buildup of fluids and inflammation-causing agents in the prostate, helping keep the cells healthy. Boston University researchers even found that frequent ejaculation supports healthy gene expression and cell metabolism in the prostate. In particular, ejaculation activates the cell's waste removal systems, helping maintain a healthy balance in the prostate. Second, ejaculation may reduce inflammation and improve immune response within the prostate. Since inflammation is a known risk factor for prostate cancer and other prostate diseases, keeping the prostate environment clean and supporting immune function can be protective. Third, the psychological aspect shouldn't be overlooked. Masturbation can relieve stress and ease tension. Chronic stress can disrupt hormones and weaken the immune system, negatively impacting prostate health. So regular masturbation may support both mental well-being and prostate health. Let's look at some real-life examples. James, a 68-year-old from Seattle, was diagnosed with an enlarged prostate in his early 60s. Following his doctor's advice, he began masturbating 2 to 3 times a week. After 6 months, he noticed significant improvement in nighttime urination and urine flow. Michael, a 72-year-old from Toronto, maintains his prostate health by combining regular masturbation with exercise and a healthy diet. He says masturbation isn't something to be ashamed of, it's a natural part of taking care of my health. Stories like these are common among older men in English-speaking countries. Of course, not everyone will have the same experience. Research shows that the link between masturbation frequency and prostate health can vary with age, overall health, and lifestyle. For example, some studies suggest that very high masturbation frequency in men in their 20s or 30s might increase prostate cancer risk, but for men over 50, Regular ejaculation seems to be protective. So, how can older men practice masturbation in a healthy way? Experts in the US, UK, and Canada agree that age appropriate masturbation habits can benefit both physical and mental health. First, masturbation should never feel like a chore or something to rush through. It's a healthy routine and a way to care for yourself. As your body changes with age, you may find that different techniques or settings work better. Try dimming the lights, playing relaxing music, or taking a warm shower or bath before you start to create a comfortable atmosphere. As you get older, your skin may become drier and more sensitive, so it's important to use a suitable lubricant. Water-based or silicone-based lubricants can help prevent irritation or injury, making the experience safer and more enjoyable. In fact, the American Urological Association and many health publications recommend that men over 60 always use lubricant. Pay attention to your technique and intensity. Squeezing too hard or moving too quickly can reduce sensation, cause skin irritation, or even lead to minor injuries. Experts suggest taking your time, experimenting with different touches and speeds, and exploring other areas like the testicles or perineum. Trying different positions or even using your non-dominant hand can also help. If you notice reduced sensation, fatigue, or persistent discomfort after masturbation, take a break and let your body recover. If these symptoms continue, consult a urologist. Most importantly, remember there's no need to feel guilty or embarrassed about masturbation. Organizations like AARP emphasize that masturbation is not only healthy for the body but also for the mind. It's a form of self-care and a normal part of life at any age. You might also consider using adult toys like vibrators or massagers, especially if you have reduced hand strength. Just make sure to keep devices clean and choose products that are right for you. Developing healthy masturbation habits can boost not only prostate health but also overall well-being and life satisfaction. The key is to understand and respect your body. So, how often is enough? Researchers suggest that ejaculating 2 to 3 times a week, or about 8 to 12 times a month, may benefit prostate health. Of course, the right frequency depends on your health, energy, and personal desire. The most important thing is to listen to your body and find a routine that feels right for you. Remember, masturbation alone isn't enough to guarantee prostate health. Regular exercise, a balanced diet, staying hydrated, and avoiding prolonged sitting are all important. Too much coffee, alcohol, or processed food can be harmful, so moderation is key. And if you have ongoing symptoms like frequent urination, pain, or blood in your urine, make sure to see a doctor. Finally, it's important to let go of any negative attitudes or guilt about masturbation. While it can still be a sensitive topic in the US, UK, and Canada, more people are recognizing it as a normal and healthy part of aging. In fact, a study from the University of Nottingham found that masturbation after age 50 can play a positive role in reducing prostate cancer risk. In summary, masturbation in older men can help maintain prostate health, as confirmed by both scientific research and real-life experience. Regular ejaculation helps keep the prostate healthy and may lower the risk of inflammation and cancer. The most important thing is to care for your body without shame. Masturbation can be a natural and healthy part of life at any age, helping you enjoy a better quality of life. If you found this video helpful, please don't forget to like and subscribe. Share your thoughts or experiences in the comments below. Your feedback helps us create even better content for you and others. Thank you for watching, and we'll see you in the next video with more essential health information for seniors.